Venous vascular disorders. You're going to have varicose veins versus chronic venous insufficiency. Y'all know what varicose veins are, yeah? Okay, y'all have seen them before, yes? All right, you're either pregnant, overweight, genetics will just do it, right? If your mama has them, you probably going to have them, just like stretch marks. Your mama had them, you probably going to have them. Your mama didn't have them, you probably won't, okay? Why does chronic constipation cause varicose veins? Yeah, okay, so you know that inside your veins, you have one-way valves that just go up because they're trying to push blood up. But when you're constipated and you're pushing, you're going, bleh, and then you break your valves. Do y'all need another baby? There's another one. You don't like the other one? Yeah, I'll get it during the break. All right. So chronic constipation could lead to varicose veins. So, ladies, be sure to poop on the regular. Talking to all of you. All right. I looked at everyone in the eye. You must have felt personally victimized for some other reason. Yeah. All right. Signs and symptoms. Y'all know what they look like, right? Okay. So they may have a little itchiness sometimes, a little edema. They're called tortuous veins. Okay. They complain of more like cramping like pain, especially more at nighttime. Now remember, varicose veins can lead to SVTs, which are superficial. Y'all said super venous. Super venous. Like what? Superficial venous thrombosis. Good, everyone. We've covered it twice. All right. Okay. So how do we diagnose it? I look at it. Thank you. And then we have a couple options. Okay. You can do sclerotherapy where they take just a bunch of salt and they inject it. And then the water will follow the salt and then the vessel completely collapses and just kind of dies. Okay. They can laser it so they can burn it. Okay. They can do light therapy on it to shrink it. If they're really, really bad, they can do surgery on them. And it's really just more for aesthetics or cosmetic appearance mostly. All right. Now with veins, you want your legs up, right? Arteries, you want your legs down. Everybody do this. Veins, you want your legs. Arteries, you want your legs down. Got it? Okay. We want them to ambulate, of course, to move. We got TED hose if they need to. Now, I would encourage everybody in here to use TED hose once you get onto the units. Okay. Because I don't care if genetics is on your side or not. If you're on your feet for 14 hours a day, you're probably going to get varicose veins. So I would recommend starting them early before you already get varicose veins from working on the units for that long. Okay? Oh, that sounds so nice. Can you just bring it up here one day? I don't care that it's 2,000 pounds. All right. Elevate your legs frequently. Okay. Make sure you keep your BMI more under control. This is all the same stuff. Can I stop saying it? Okay. Don't wear really tight clothing, right? Have a high fiber diet. Why would you say that for varicose veins? Yeah. Okay. Walk a lot. Do not cross your legs, which is funny because that's all my mom told me to do when I was growing up. Like, cross your legs. You don't want to see your panties, right? Be a lady for her. And now they're like, oh, yeah, now you have varicose veins because, our parents were Southern Baptists and they're like, keep your legs shut, Yeah. Now, with varicose veins, you can massage because you can massage the blood kind of back up, right? That's fine. Who do we not want to massage? Right, DVTs. All right, we're going to compare varicose veins to chronic venous insufficiency. So basically, this meant you have veins where the blood absolutely cannot get back up, and it starts at the ankle. Varicose veins, y'all see, usually are much more in the thighs, right? They can happen in the legs too. But chronic venous insufficiency is not like there probably is a little bit of genetic component to it, but not really. This is where the blood gets trapped in the veins and it can't get back up. Okay. So that happens as you get old or if you've had a DVT. Okay. Now, why, if you have a pelvic tumor, would this be a problem? Yeah, it's stuck. Like if you have a giant pelvic tumor, then the veins can't get back up. It's obstructing it. Yes. All right. Any vascular malformation, so like your veins were already kind of weird and tortuous to begin with. Overweight females who smoke are like the trifecta for CVI. Okay. Or if you just sit around all the time, or if you stand for 14 hours a day, 3 shifts a week. Hello. All right. So what will I see? Their legs are going to be a little edematous because anytime you change pressure in a vessel, your body says, exactly, something is wrong. Their legs may feel achy or tired. They may get all these new varicose veins. Have y'all seen people that have this? You'll be able to diagnose this in the grocery store now. Let me show you. Okay. Their legs look very itchy, very flaky. Yeah. They look leathery and kind of a darker brown color. Yeah.
So chronic insufficiency leads to varicose veins.
No. Varicose veins can lead to chronic venous insufficiency. Okay. Let me show y'all what this looks like.
Okay.
That's why I can't go to the grocery store anymore. I have to get curbside because every time I go to the grocery store, I diagnose people with other ailments. I'm just looking at them like, you got acanthosis, you got chronic venous insufficiency. Like I can diagnose it. This is what their legs look like. Huh? What? No, it's free. Yeah.
I got seen mile.
Yeah.
Oh, well.
Y'all seen it, or I've seen it. Now you know.
What? People who just have mild Botox.
No.
Injected to. I thought sodium.
No. Botox just paralyzes your muscles. What? Well, okay, so. But not Botox. Okay. But not for chronic venous insufficiency. Oh, if not Botox. Botox has to go into your muscle. It paralyzes your muscles. Okay. All right. So how do we diagnose? There's something called a duplex ultrasound. Oh, did I do that? Did I do all the signs and symptoms?
No.
Oh, no, I didn't. I didn't finish signs and symptoms. Let me go back. Sorry. Their skin, obviously, y'all saw it. It looks leathery. It's very itchy. It's very flaky. They can get venous ulcers, which are different. We'll talk about the difference between the two. It can lead to their veins bursting because it just fills with blood. They have had people die this way. Because if you burst one of those veins, like, is it going to take you a long time to bleed out? Yes. But could you? Yes. Like, let's say it burst overnight and you don't feel it because it doesn't hurt. And then you woke up and, well, you didn't wake up. Y'all laugh, you sadists. Wait, when? Oh, that was because he had an MI or something different. All right. In chronic venous insufficiency, we may also see lymphedema. What is lymphedema?
Well,
That is not true. That is lymphadenopathy.
the lymph fluid.
The lymph fluid third spaces. That's what it is. Y'all, this is very, very hard to treat. Y'all probably seen people like this before. It is so hard to treat that they have clinics all over the place. If y'all actually pay attention, like when you're driving around and it'll say lymphedema clinic, they're everywhere. But this is what lymphedema looks like. If you don't know.
Yeah. Oh, I thought I had.
So just
with one month big on nervous mass, you can tell this.
the
True lymphedema.
she was a very big waist with like one cheek leg and then other leg. It was a Halloween movie.
Okay, moving on. No, we gotta move on. All right. So they may also get episodes of cellulitis because that, it's fluidy and whatever. Now with chronic venous insufficiency, remember your veins are right underneath your skin. Y'all can see your veins through your skin most of the time, right? So if you can see it, okay, what'd you say?
Yeah.
Oh, okay. So I thought somebody said something really weird, but I'm not gonna tell you what I thought you said. Anyhow, so the vessels are right underneath the skin. Yes. Okay. So, and they're a little leaky. So that means that your skin is sitting in water, right? And so it's not gonna, yes, it's gonna get soggy, and that's where you get the ulcers. And those ulcers are weepy, right? And they don't heal because they're constantly wet, right? Are y'all with me? Okay. All right. We will diagnose with a duplex ultrasound. So we're looking at the blood flow speed and direction of the venous blood flow. Yes?
Yeah.
Okay. If they have skin ulcers, we may need to give antibiotics because they get infected like real easily. Yeah. We may need to do sclerotherapy. What do we say that was? The injection of salt. Okay, now realize it's not going into like your arteries, right? It's just going into a localized area where the vein is. Okay. Endovenous thermal ablation. What does that mean? Burn it. Yes. You're going to go to the vein and burn it. What's a vein ligation? Yep. You're going to tie a band around it until it's like, it's so tired of living that it just dies. That's how we kill hemorrhoids too. Do you know that? When you got big old giant hemorrhoids coming out of your bunghole, they will put rubber bands around them until they die and fall off. Yes. Skin tags, you can do that too with dental floss. Sorry, I'm weird, but yes, that happens. Okay. Anyhow, that's how we do it. And then you can do a vein bypass if all else fails. Pardon? No, we go around it. Right? Okay, we're just gonna go around it. You with me? Okay. All right. How do we want our legs? Oh, loose fitting clothing. Elevate your legs. Don't cross them. Move. Ted hose. Do really good skincare because they're gonna be weepy and wet on their legs. Y'all saw what that skin look like? You better take good care of that skin. They can also get DVTs because that blood isn't moving very well, right? Right? Keep their BMI less than 25. Moisturize those legs. They are very ashy. Yes, yes. Tell them to stop smoking. You're going to pick stop smoking for everything in this entire module and for everything for all of time. What are the two big things that you will always pick on nursing school exams? Stop smoking. Good hand washing. Maybe. That's fine too. You got me? Do we understand the venous vascular disorders? Good, good.